Can you highlight a hypothetical or de-identified, story that shows the value that T6 has on trauma patient management?
Well, yeah. So we think of the data that's collected by T6 to kind of fall into different tiers. Like there's different tiers of analysis. So like the first tier of analysis is like right at the point of care, you generate a score or you visualize data on an overhead screen. Right away, it's informing your awareness of that patient. There's another layer of data, another layer of analysis, which is quality improvement. Another layer, which is research. Another layer, which is prevention. Another layer, which is health policy. So the data that's streaming out has these can be repurposed in multiple ways to serve multiple different purposes. One simple thing is that in Cape Town, the user interface was open and the residents were documenting on it. And they were about to skip a step in documenting a spinal cord injury. But the digital interface pointed out that they should do a neurologic exam. And they picked up a patient with a spine fracture who could have, gone on to be mobilized and have a worse than spinal cord injury. So that data collection structure kind of placed some guidelines or guardrails around the care that created a bit more comprehensive care in the moment that would have saved a bad complication. Similarly, the system was being used in a trauma center in Texas, and there we had the iPads were acquiring data, but they were projecting data on a big overhead dashboard above the patient's bed. And a trauma surgeon walked in who hadn't seen the T6 system before and right away read the dashboard and realized that the patient needed to go for an urgent CT scan. And he, without even understanding the system or what was happening, it sort of immediately fast-tracked his judgment, and the patient was urgently transported for CT. So it's that early sort of collection of data that converts a chaotic and uncertain environment to a little bit more data-informed environment that can actually change patient care.